welcome to all our viewers. My name is Deepa and I am an occupational therapist working at PlayStreet. PlayStreet is an organization that provides educational services to help children with special needs become independent and live up to their potential. We offer parent empowerment programs, an integrated schooling program, and a variety of clinical services. In recognition of Autism Awareness and Acceptance Month, our focus is firmly set on the profound significance of dyspraxia. We aim for this series to shed light on the complexities of dyspraxia, address the specific hurdles people with dyspraxia face, and raise awareness about its importance with the neurodiversity movement. Today, we are on the sixth talk of our series under the segment which focuses on visible effects of dyspraxia. The topic for today is impact of dyspraxia on sensory processing. And we are honored to have Ms. Anjali Joshi with us to share her valuable thoughts and information on the same. Anjali Joshi is a renowned pediatric occupational therapist and recipient of Spandan Award from the Ministry of Justice and Social Empowerment. She is a visiting consultant and expert advisor for the Muskan Foundation, Nai Disha, and Forum for Autism. She has authored and co-authored over 20 research papers and also co-authored a chapter on occupational therapy for children with autism spectrum disorder for the book Comprehensive Textbook on Disability. She served a project director and faculty lead at PlayPal training program and rehabilitation services at a child developmental center in Mumbai. Welcome, Ms. Anjali Joshi. We are very grateful. We are very grateful that you have taken time out of your schedule to share your knowledge about impact of dyspraxia on sensory processing. So would you like to share any thoughts or your views before we get started?
I think it's great that, during this Autism Awareness Month, that we are also looking at another aspect of how children with autism struggle with motor deficits and with learning. And this dyspraxia, the topic of dyspraxia is going to kind of cover that area. And I'm looking forward to sharing my views and thoughts with the audience today.
Thank you so much, ma'am. So now can we just proceed further with the questions?
Yes, sure.
So ma'am, could you just tell us what sensory processing is? And how does sensory processing also contribute to the motor experiences of the neurotypical children?
Let me begin at the beginning when we talk about sensory processing. See, it's like this. How do we learn about the environment? I mean, as from the infancy onwards, how do we really know what is happening around us? It's through our five senses. All of us know that we have our five senses. We have the sense of vision, we have hearing, we have taste, smell, and touch. Now, all these five senses tell you where you are in the world around you, what things do you have around you, and to know about that environment. Now, besides these five senses, there are three more senses which do help us to get familiarized with the environment. And those three senses are not so commonly heard and known because they almost are invisible senses, so to say. And those three senses are the proprioception or a joint sense. It's our joints which tell us the difference between a gentle touch against a firm touch, or a gently touching something or firmly holding something, right?
Right.
The second sense, as I said, is the vestibular. So the seventh sense, so to say, is the vestibular sense, something which is in our inner ears. There's a small little organ or a body part which is in our inner ears, which help us to learn or maintain balance and posture. So to somebody who's not familiar with these words, I'll give you a simple example that there are people who dislike movement or hate to sit on the swing or find discomfort while they are going up the mountains. So if the bus is going taking a spiral path, people complain that they feel nauseous. Or there are some people who love giant wheel, when there's some who will say, oh, I can't even watch other people be on the giant wheel. So there is this organ which is called a vestibular apparatus, which is responsible for this kind of ability to maintain our balance when our head moves, put it in a very technical word. So this is that another sense which is responsible for our body posture, for our body awareness and body tone. And by tone, I mean the typical resistance that we feel while we are standing. Or why do we stand? Why can we stand straight? Or why can we sit straight? That's because there is something called a body tone. The last sense that I want to talk about, the eighth one, is the interoceptor. How do we all know that one is hungry, one is thirsty, or one needs to go to the washroom, or I'm tired and I want to go to sleep? We are aware of that because there are those what is called as the interoceptors in our body which send that message to the brain. Now, if all these eight senses work together, we are able to integrate these senses together to effectively work or interact with our environment and learn from the environment. And this is where I want to talk about somebody who's looked at this in a most scientific way and come up with what is called as the sensory integration therapy, which some of the listeners today must be familiar with, because that's something which we talk about with occupational therapists will talk about when we talk about developmental disabilities and intervention for the same. So, Dr. Jean Ayers was an occupational therapist and she also was a psychologist, and she came up with this entire theory of sensory integration. And her theory focuses on all these senses. And I will quote her example over here when we talk about processing. Let's take an example of how do we, a simple thing of how do we peel an orange and eat an orange. And, to quote her, like she says that supposing you're tired and you're exhausted and you go to somebody's house, visit somebody, and the person says, would you like to eat an orange? You say yes. You peel that orange and you eat it and you feel very satiated. Very simple, right? I mean, it's something which we do almost, so very frequently and so very often. But now let's look at it from the sensory point of view. What exactly goes on for the simple task of eating an orange effectively, quickly, and to get that satiation from it? One, of course, is that you heard that, would you like to eat an orange? So your auditory system tells you that you know this particular word, you know this fruit, and you are anticipating what's coming in front of you. Much before that, in fact, you also recognize that you're thirsty or hungry. So your interoceptors tell you that, yes, you need to have something. When that person presents that orange to you, your vision tells you that I know this fruit and I know it is a fruit and I know what's the approximate texture or a weight of this fruit. So you reach out to grasp it gently in your hand, but not that so gently as if you're holding a paper, but not as if you're holding a coconut or a jackfruit in your hand. You dig your fingers and you peel that orange, and by the time you start peeling it, your mouth is already watering because you are anticipating the taste. While doing all this, when you bend down to say pick up that orange from the table, you don't really collapse down. Your hands just reaches out, goes out with a particular force and resistance, and you just pick it up gently, come back to your original position, peel it and eat it. So look at it like this, So what exactly is happening? All your eight senses are working together to do this simple act. So you can imagine, even for this kind of a task, when you need integration of all these sensory systems, how crucial are these sensory systems? And this is what is sensory processing all about. So for any motor act or any movement to be performed effectively and efficiently, you need these senses. And that's where the connection between the sensory systems and the motor activity or a motor task comes into the picture.
Okay. That with the example, ma'am, it helps us understand how all our senses work together,
Yeah.
basically. So, like, how would this sensory processing be different for the neurotypical children, is what I want to understand.
Say when we say that there are children who are neurotypically developing, we're saying that most of the times all these sensory systems are well integrated. They are sharing information and messaging and signaling to each other to effectively work, to function in the environment. Having said that, I also want to emphasize one point, that it's important to know that just because somebody is neurotypical, a child, adult, whoever, there's no, it doesn't mean that all of us have 100% sensory integration. Because it's important to remember that, because just because a child has a dysfunction doesn't mean that he has absence of sensory integration. So both these things are very important. So for a neurotypical child, he's most of the times, or a person, adult also, most of the times, this person is able to integrate the sensory information coming in, is able to identify and isolate the crucial sensory input that he or she needs to focus on, and eliminate the other sensory inputs that are coming in. So for instance, if you're in a crowded place and somebody is sharing a piece of information which is very important for you, you're able to kind of nullify the sound around you and focus only on that bit of information that's coming in. So that's that filtering mechanism which is there. So with neurotypical persons, most of the times, this person is able to do this effectively. Having said that, there would be some times which would kind of depend on your state of anxiety or your fatigue, when you are not able to effectively filter this information, and you are not really able to optimize your functioning. The difference but here is that most of the times we are able to do it. One, if we are talking about a neurotypical person, most of the times he or she is able to do it. He or she, or the brain of that person, is able to come back to that state of optimal functioning, which is what is different as compared to a child or a person who has neurodiversity, or as we call it as sensory processing dysfunctions, and dyspraxia becomes one of such conditions. So when we talk about dyspraxia, we're looking at three elements. I mean, I'm sure the listeners here are familiar with these, and the previous talks, there must have been this kind of conversation. We're looking at ideation, planning, and execution. We're looking at learning a new skill and the steps involved in learning these new skills. In all these steps, if you're effectively able to process sensory information, there is the smooth transition from ability to ideate, plan, and execute a newly acquired or a new task or a novel task. And that is where there is a challenge, because the sensory systems are not really processing the information optimally, so to say.
Okay.
Does that answer your question?
Yes, ma'am, it does. Thank you
Okay.
so much.
Thank
So
you.
I just want to understand, like, what could be the common signs or certain symptoms for sensory dysregulation in individuals with dyspraxia? Like,
Yeah. Uh, I think the common signs and symptoms, one can kind of uh, be aware of those early signs, so to say, or the red flags, which is, because you can identify early, you can treat early, obviously, there's going to be a huge change and difference in the child's functioning. And some of these, let me start with some of these red flags which warrant attention. So, for example, in a preschool child who comes across as a very clumsy child, so if the parents or the teachers, complain that he's very clumsy, he's very awkward. Like, I remember a teacher saying that if I'm writing something on the board and I hear a compass box crashing down, and I didn't have to turn back to see who this person, who could have done that. I definitely knew it was this Rahul, little Rahul, who must have dropped his compass box. So, something like that. Or the parents are saying that we go to a restaurant and we realize that, oh my God, this guy is going to do something. And there you go. There are plates crashing, glass crashing, spoons crashing, and one knows that it's Rahul who is there in the restaurant. So something like that. So it's a clumsy child is the first thing that uh, the parents, it requires kind of monitoring or overseeing. I'm not saying that it really requires intervention all the time, but one needs to be a little aware of this particular feature and keep a track on child's development. Along with that, delay in fine motor skills. So typical milestones per se may not be delayed, but a child has difficulty learning with, even though he has been made to practice, has difficulty even say simple thing like opening a Ziploc bag or opening a zip of the bag. Difficulty doing bilateral skills, so two hand skills or two leg skills. So the child has really is finding it hard to release a ball or catch a ball or kick a ball or learn a tricycle, and all this I'm saying despite adequate amount of exposure and practice. He goes to the garden and he finds it hard to maintain his balance on the swing and push and pump the swing with his body and so on. So these are some of the areas that can be considered as red flag. Now, over a period of time, then once one can look at whether what is a child's attention, and a child who has a very short attention span has difficulty problem solving or difficulty with executive functions. So, like for example, typically one would expect that say a 4 or 5 year old child, when we say that okay we are going out, the child really knows to look for his bag and he look for his shoes and stuff like that. And or even say like get ready for a school bus, when mom says in 15 minutes your school bus is going to come on, pick up your bag and pick up your uniform and so on, and this child is able to do so. Some of these literally from starting with these kind of skills, when there is a challenge, despite, again, I'm repeating it over and over again, but despite adequate amount of practice and opportunities, the child is still struggling with this. And of course, very, very importantly, the child's difficulty in emotional regulation. A whiny child, a child who's like almost like a fragile child, who would cry for no reasons, and one really doesn't know when is his mood going to go off. That sort of a child. So this emotional regulation difficulty is something that needs to be monitored and looked for and observed for at risk for dyspraxia, if I can say it very safely. So yes, to name, as I said, clumsy child with attention deficits, fine motor difficulties, bilateral motor skills difficulties, learning a new task despite repeated practices, and emotional dysregulation, challenges in executive functions or organizational skills, and learning simple fine motor skills like using a spoon, using a fork, opening a tight container, opening drinking water through using a bottle with a straw. All these are something which require an assessment or a visit to a professional to rule out that is, to rule out the signs of dyspraxia.
Right. Okay. So, ma'am, like when you talk about asking them about like the early intervention, so like how early could we just like know that? Like, by is there a particular age to which we know that the child could be diagnosed with dyspraxia? Is there any particular age for that?
Well, I think what I would like to rephrase this in the sense that I'm an occupational therapist, so I'm not going to diagnose the child with dyspraxia. It's better that there is a medical professional like a developmental pediatrician or a pediatrician or a psychiatrist, somebody like that, who's looking at the diagnosis bit of it. But from my point of view, what I would say is, as I said, all these things. So, say a pre-primary teacher or parents, very important. The parents say feel that there's something amiss, and they start worrying about that, or they see those kind of things, say from 2.5 and 3 years of age. No harm in starting very simple strategies, which we are going to talk about in today's talk. because we are going to really monitor whether this child has difficulty with praxis or is likely to have a diagnosis of dyspraxia.
Uh, so that at least would help the parents also to have early intervention, right? So
Yeah,
like,
that's right.
how does sensory dysregulation impact motor planning in a child's activities at home or at school or in any other social settings?
See, as I told you earlier, that there's so many challenges or difficulties which can arise because the child has difficulty learning a new novel motor tasks. We have to remember one thing when we talk about praxis or dyspraxia, we're talking about challenges in learning a new task, something which the child has been doing repeatedly. You may not see any problems or any issues there. So, for instance, the parents may say that, oh, he loves to swing on a swing and he regularly goes to a park and he swings. But then they add to it, but you know what? We went to another park last time, and a new park, and the swing was slightly different. And our fellow behaved as if he has never seen a swing in his life. And that kind of makes me alert, and I need to probe and get more information. So when we're talking about uh, praxis issues, we are talking about novel situation and a motor skill. So then look at all these other challenges that I mentioned. They are going to come in the way of the child's learning across all situations. So, for example, if the child has difficulty with fine motor skills, it's going to affect the child's art and craft activity or pre-writing activities that they do, literally starting with fixing Lego blocks. Attention issues and organizational skills is going to impact the way the child does a jigsaw puzzle, or the way the child sits for story telling or music class in school. So literally starting from pre-academic skills onwards, and very importantly, in terms of functional skills, the child he's what is expected from by his age. This child is not able to even use a open a ziploc bag or fix a velcro or eat finger food, feed himself without spilling, use a spoon or use a fork to eat things. And very, very importantly, it's going to impact the child's play skills. Because if I can't learn a new motor skill, if all the children, all his peers are playing on the slide or going on the slide, trying different tricks on the slide, going on the swing and, going slow and fast and going standing on the swing. So all sorts of uh, the tricks and the funny things that children do in the playground, this fellow will not be able to do. So his play is going to be very, very limited, and which is going to impact the social interaction, because somewhere the child recognizes his deficits or his challenges, and that leads to the child being aloof or aggressive or doesn't want to mix up with other children because he doesn't get those social cues and cannot react effectively. Now, all these things, any activity that we're talking about, as I said, sensory processing is about the environment. So many sensory inputs come into the picture, and this child is going to have difficulty tolerating loud noises or some children, other children sitting next to him, or understanding instructions the teacher is giving him when the classroom is noisy. So all these sensory inputs too are going to impact the child's functioning. So anybody and everyone, any and every professional or a caregiver who's in child's contact or is helping the child in his skills. So it could be it could be parents, grandparents, teachers, uh, sports teachers, anyone and everyone. He or they are going to notice these kind of challenges, which is where challenges which are due to the praxis issues or sensory processing dysfunctions resulting in praxis issues.
Right. So, ma'am, that completely answers my question. So, like earlier, you said that there are certain red flags that come along with dyspraxia where the parents can be noticeable. But other
Yeah.
than that, as a professional, what are certain assessment tools that you use to evaluate sensory regulation, the difficulties in individuals with dyspraxia?
Uh, as an OT, then, if I can categorize the test, we have something which is what like standardized test, observational based tests, and parent interview. So one can categorize them under three headings. And uh, when we're looking at any of these standardized tests, there will be three aspects that those tests are going to evaluate or look at. One, of course, is the sensory element of it. The second is the motor component. And the third could be a visual component. Because with dyspraxia, you're going to see problems in all these three areas, right? So there would be three components which will be evaluated or assessed. So with respect to standardized tests, which are either observation based or criteria based, couple of tests. I mean, I'm going to name some few tests. I'm not really going to give you detailed description of it, but I'm sure even parents attending this particular webinar must have heard these names. So something called a sensory processing measure, or SPM, sensory profile. SOCI, which is a wonderful test to look at sensory discrimination. BOT, as for fine motor skills and motor skills. PDMS, which is for younger age group, again for fine motor skills. And very, very importantly, again, visuomotor integration, test of visuomotor integration, or VMI, which looks at visual perception, and not only visual perception, motor integration too, something which impacts the child's handwriting or writing skills, so to say. So some of these are commonly used tests. Unfortunately, none of these tests have been standardized on Indian population. That's the biggest drawback. So you do look at actually standardization done on Caucasian children, and you do see sometimes challenges when we are using them on Indian population. Say, for instance, I'll give you a classical example of VMI. Our children, Indian children, are used to finger feeding themselves and exposed to academics from very early age. So their motor skills are pretty well developed. And a lot of times, when you're administering this test and comparing it with the norms which are available for Caucasian children, you do see a lot of discrepancy, and our children seem to be performing very well. And it becomes a challenge to really sort of give number to that deficit, because you are seeing deficit in the functional areas, but it doesn't really get reflected in the scores. But having said that, of course, these standardized tests do have a critical role to play when you are looking at assessment. Other than that, there are observational based tests. Like, for example, actually, SOCI would be an observational based test where you're looking at, you're asking the child to perform certain skills or certain positions, and you rate the child to see whether the child has issues in vestibular processing, proprioceptive processing, and so on. But I think I want to highlight here very important tool, and that is my observations or a professional's observations and the data obtained from the parents. Because I think all these tests do have their value, but the rich data that you can get by just observing the child in his familiar environment, in his play environment, in the classroom, is going to give you a lot of information about how dyspraxia is impacting the child's functioning. And of course, the concerns parents come up with. So just talking to the parents to understand what are their challenges, because I think that kind of sets the foundation and gives you a starting point of what is it that you're going to address during your intervention. And very importantly, I think observations and data obtained from the parents also give us the strengths of the child. And you're familiar, all of us, we know that it's the strength based approach which works very well with when we talk about developmental disabilities. And to use those strengths, what's the best source but to listen to the parents, hear their reporting of the child, and observe the child to really look at what is he good at, so that we can build up our intervention on those strengths. So yes, so there could be standardized, observation-based, data obtained, and observation of the child are some of the things that an occupational therapist would use to evaluate a child with praxis issues.
Like, absolutely, ma'am. So, like, you just told us, like, there are certain approaches that we use, right? So, in occupational therapy intervention, what are some of the effective interventions, basically for addressing sensory regulation issues with for an individual with dyspraxia?
Uh, See, as we said, your question, it's also says the term, we're looking at sensory dysregulation or sensory dysfunctions. And therefore, the immediate frame of reference for intervention that comes to anybody's mind is sensory integration frame of reference. But with your background as an occupational therapist, we know that an occupational therapist has many magic tools in her kitty to work with a child with disabilities, and SI frame of reference is one of such tools or a frame. But it's not only the sensory integration frame of reference that one would use or approach that one would use. An OT would use combination of intervention techniques to address different deficits that we looked at, like the perception problem, handwriting problem, academic challenges, emotional dysregulation, play, social skills, and so on. So it could be a combination of sensory integration frame of reference. It could be sometimes a visual perceptual approach or sensory motor approach or pure motor approach, so to say. And I think uh, across, of course, I mean, there could be different approaches, but I think the key thing that an occupational therapist, a key tool an occupational therapist will use across all these frames of reference would be play and functional skills. Because as we call ourselves occupational therapists, we're looking at an occupation of a child. And what is the child's occupation? Fine. The child's occupation is play and academics and functional skills. So we will look at all these three areas or use these three modalities, three key elements to address the dysfunctions.
So, like, ma'am, you're saying that we address all these certain areas. Could you share some sensory-based activities or any strategy that you yourself use in your therapy sessions with clients with dyspraxia?
So, see, I mean, we are looking at primarily when we talk about dyspraxia, I think we're looking at tactile, proprioceptive, and vestibular system dysfunctions. So, SI or sensory integration therapy is a combination of art and science. The beauty of it is it looks like play, and it almost looks like the therapist is having fun and the child is having fun in a therapeutic environment or in the clinic setup. But sometimes the misleading point is also this, because a lot of times other professionals may think that, oh, she's just playing with a child. Where is the therapy? Where's the technique? And that's the beauty, and that becomes a challenge too. So we're going to use all sorts of play equipments, movement-based equipments in our therapy. So, for example, a dyspraxic child, typically when he comes to OT, a therapist is going to use different kinds of swings. It could be a swing which moves fast, which moves very slowly, a large swing, a small swing. So different kinds of swings. We would use, equipments which could give proprioceptive and vestibular input, and the best would be a trampoline or what we call it as a sorry, I'm not getting the name just now, but it would be a trampoline of different kinds. Then there would be a trapeze, maybe. There could be a jungle gym or an outdoor activities like going on a jungle gym to slides, a teeter-totter. So many such things would be there as part of our uh, intervention as intervention tools, as if I may say. But along with that, as I said, there is a combination of intervention approaches. So a therapist would use even simple play-based uh, tabletop activities or games. So different kinds of jigsaw puzzles, constructional activities, coloring, painting, all sorts of toys and games and play which incorporate the tactile, proprioceptive, and the vestibular system. Primarily, of course, there will be other systems like the visual and the olfactory, but primarily these three systems. So lots of such activities is what uh, we would be using in our therapy. The word I was looking at was a jumperoo. So it's a modified trapeze, and typically a jumperoo is something which one would see only in the therapy setup. Outside, most of the places you're going to see trampoline. Sorry for that slip. So the activities that we will use from sensory point of view are these primarily, but along with that, there would be other things, or all sorts of fun things like puzzles and jigsaws and maybe coloring activities and pasting and craft work and so on and so forth. So OT in short for a child, any child with developmental disabilities is fun and play.
That's absolutely right, ma'am. Play is the most important occupation for the child. So, like
Yeah.
when we are talking about the intervention strategies for child with dyspraxia, so are they different for a child with dyspraxia and a child with autism?
Good question. And I think what I would like to say is there is no one yes or no answer here to this question. Because I think it will depend primarily on how dyspraxia and or autism is affecting the child's function. Can they coexist? Yes, they can coexist. Because when we talk about dyspraxia, from a little technical point of view, I'm looking at the sensory discrimination dysfunctions, right? And when I talk about uh, major issues with autism, I'm looking at sensory modulation dysfunctions, inability to modulate the sensory inputs that is coming in, which is, if I may label or call it, it's a little more mm, more severe, if I can say. I mean, I'm really using a very colloquial word here. More severe form of sensory processing dysfunction. With dyspraxia, I want to see primarily sensory discrimination issues. So, with ASD, with autism, it's the sensory modulation difficulties which come across as the primary area of dysfunction, which can coexist with motor planning, which is part of what we call it as dyspraxia. So the intervention needs to be focused on both the issues. The child with ASD is likely to struggle with ideation. Going up to the level of motor planning and execution, which are the three major steps of or three components of praxis. So this child is going to struggle with ideation itself. The child really doesn't know how to interact with the environment. How do I play with a certain toy? And what do I do with this particular object? To that extent. So the child is going to struggle with ideation. The child is obviously going to struggle with engagement, and the child is going to struggle with participation or sustained participation, which may not be the case with a child with dyspraxia. The child with dyspraxia may have an ability, often, most of the times, has an idea. It comes to even planning, he may vocalize or verbalize the plan, but when it comes to execution, the child struggles. And that's where the challenges would be. So many a times, uh, intervention for dyspraxia is going to be very, as we say, very, very child directed and child driven. Whereas when it comes to ASD, it might not be that child driven, because the therapist may have to support the child, scaffold the child to get into that, to get across that barrier of ideation. And that's where those subtle differences would be. So again, as I said, there's no definite yes or no answer. It will clearly depend on what part of the sensory processing dysfunction is impacting the child's functional skills the most, and which area I need to address first to help the child become functionally more independent or reach to the next level of functioning, so to say.
Right. So, ma'am, like as occupational therapists, we try our level best to help the children develop the functional skills, the play skills, and
Absolutely.
everything. So now that when we come to the holistically, when we look at a child holistically, uh, how do we collaborate? Like, how do you collaborate with other professions like speech therapist or could be a physiotherapist and special educator to support these individuals with dyspraxia in managing their sensory challenges?
I think it doesn't really change whether what is the diagnosis, frankly, because I think working with any child with developmental disabilities, I'm sure you'll agree, and all the professionals will agree, it's a multidisciplinary or to a large extent even transdisciplinary collaborative effort. Especially, I think in a scenario like ours, it needs to be a transdisciplinary effort because of the skewed ratio between the number of professionals against the number of children who need services. Correct? And so is true with dyspraxia. So it's very, very vital that we work in tandem and we interact periodically amongst ourselves, share our thoughts and share our notes and share our feedback with each other to optimize the child's functioning. So I think that collaborative approach, the transdisciplinary approach, getting ideas from other therapists, implementing the same in our session, all that is very critical when it comes to working with working with a child with dyspraxia. So, like, let's, as I said, with in dyspraxia, you have challenges in so many areas as fine motor skills or behavioral outcomes or behavioral challenges, play, social skills, uh, bilateral motor activities. Now, all these things are something which every professional is going to use or need in her or his therapy sessions, including the teachers or the special educator. Forget the special educator, even the teacher is going to need all these areas. And this is where the child is struggling. So, from an OT perspective, uh, simple tips that making other professionals aware of these sensory challenges, just letting educating the professionals as to why a child is whiny or why is this child behaving the way he is behaving, or why the child doesn't want to finger feed himself, or why the child cries excessively when somebody just dips his finger into finger paints, or screams loudly when there is too much noise around him or her. What sort of why this child would need movement breaks to regulate himself or organize himself in, say, in a speech session or in the classroom. What is sensory overload and why certain behaviors occur and what can be done. Things like teaching, helping the teachers work on breaking a task or breaking a particular component that they're teaching into smaller units and focusing on one unit at a time, so that the child is able to get that information correctly, process it correctly, and execute the task well, giving him that adequate amount of time to process the auditory information and execute the task. So some of these things are something which would complement or which would enhance the child's development or enhance the child's functioning. Along with that, certain environmental modifications are something which an occupational therapist can talk about. For example, where is this child placed in the class? Is the no If the child has auditory hypersensitivity, is the noise too much in that particular corner? If the child has visual hypersensitivity, is the light falling in such a way that that's distracting the child? Does this child require a writing tool? Does this child require, say, a pencil gripper to to improve his tripod and improve his writing? Does this child require a simple easel or a slant board to place his paper so that the child can see what he is doing correctly and can improve his handwriting? Does he really require simple strategies like placing, one thumb placement between two words to space the words correctly or to improve his handwriting? So there can be so many such simple tips that can help the child function better, can, optimize the intervention other professionals are offering to the child. But for all this, as I said, we really have to have that collaborative team approach while we are working with the child, keeping in mind the parents' concerns and the parents' strengths also, and their priorities.
Absolutely, ma'am. Basically, when we work with parents, we work with therapists as a team again. When, we have parents, they are overwhelmed with so many things, they have so much
Oh, yes.
expectations. So, what advice would you what advice do you have for our parents and caregivers, like with children with dyspraxia who are struggling with sensory regulation difficulties?
As I mentioned earlier, I think the first tip, I wouldn't say advice, but the first tip I would like to give to any parents is treat early, which means I want to, uh, I want the parents to have the courage to get up and say, look here, even though I'm a layperson and I'm a parent, I know my child the best. And I am coming to you as you are a professional and I'm coming to you to say that there's something amiss, and I know there is something amiss in my child. So which means, of course, we as professionals also keep that in mind and say, yes, if the parent is saying something, I need to listen to it. That's very important. So the parents can look at it as, I do see something, I do see red flags, don't ignore, take an opinion of somebody and start working. Of course, how do they start working even if they don't get help? So a clumsy child or a child who's struggling to learn simple daily functional skills or simple play skills like throwing ball, hopping, riding a cycle, art and craft classes or activities are too painful for him. And again, I'm repeating, emotionally fragile child. These are some of the things which are very important sign or very immediate signs that one need to address, because what we none of us want to happen in a child with dyspraxia is to shatter the child's self-esteem and self-confidence. Because here is a child who knows that I can't cope up with this particular skill. The child is aware that there's something amiss. I can't really do things the way I want to do. And that's something which is very, very shattering and very heartbreaking to see. And this child really feels that I'm no good and I don't want to do it. And then this child is going to back out and say, I don't want to do something. I remember this child who I used to work with, where, she was aware of her motor planning issues. And I'm just giving you, and I'm using a hypothetical name. And I said, Manali, you know what? Let's play on this scooter board. What you have to do is you have to lie down on the scooter board and just come down the ramp. It goes fast and it's a lot of fun. And you know what? Even a 4-year-old can do. You're so smart, you'll be able to do. And immediately she said, but auntie, I am 5. So it was her way of saying that I don't know how to do this, but I don't want to accept my challenge and I don't want to say I don't know. And she came up with a quick answer and said, but auntie, I'm 5, so I don't have to do it. So it was her way of saying I don't want to try. And it's so sad to see that the child wants to do it and can't. And I think that's where the parents, when parents come to the professionals, it's important for them, for us to hear and listen to them. Now, with all that, of course, we will have lots of therapy strategies, as I mentioned earlier, and we will be using play therapy. But there will be parents who, especially in our country or in our society, there will be parents who may not receive intervention as early as possible, or they may not be able to come across professionals that early. And I would definitely want to tell these parents that for sure, do not compromise on outdoor play for the sake of academics. And that's the first and the easiest and the simplest thing that they can do. Outdoor play and making the child independent in functional activities like the self-care activities, bathing, dressing, toileting, wearing shoes, combing hair, packing bag, and so on and so forth. All these activities are going to be very, very therapeutic. So, because if you look at simple thing like packing a bag, It involves all those components which I told you about, which are part of praxis, ideation, planning, and execution. And even giving a child a chance to pack his own bag, look at what is written in the timetable, identify or track the book from accordingly, and put it in the bag. Go back and again look at the timetable, locate the book which is there. The second uh, period is English or craft. So look at what you need for craft and pack it in the bag. So literally doing these kind of things are something which are very, very therapeutic. So for parents, yes, when you see red flags, reach out to the professionals. Definitely focus on outdoor and indoor play. Do not compromise on that. Definitely do not compromise on letting the child get away without doing functional skills by you doing them for him. Encouraging the child to engage in household activities which do require, which are the foundation of executive functions, are some of the strategies the parents can use to complement the therapies the child may receive in future or is receiving at this point of time. And all these things are going to address the sensory processing difficulties, the motor planning difficulties, or motor skill execution challenges which a dyspraxic child is likely to come across. Does that make sense?
Yes, ma'am. I was just going to say that the piece of advice that you've given is like a good takeaway for our parents as well, because they start to, listen to more the children that, no, fine, okay, let him sit in, let him do this. Like,
Yeah.
just to quickly get away with the activities, they help the children with very simple activities by just, helping them with the basic areas also. Like, let me just do it.
Yeah.
It's quick.
Yeah. So I'll give you an example. There is a child whose mother used to get him for therapy, and in the therapy session, we would work on fine motor skills. So the child would do his collar removes, and he would do different kinds of pegs and lacing and all sorts of those fun activities that we do in therapy. And at the end of the session, I would say, okay, it's time to go home. And the mom would immediately get up, pack the child's bag, help him to, forget help, literally tie his shoelaces and carry the bag for him and would go out. And I would like, and of course, if possible, in the corridor, feed the child. So open the tiffin for him and start feeding those little popcorns or whatever that she had. And and then I asked her one day, I said, if that's the case, what I did during my session, how are we really teaching the child to generalize the skill? And how are we giving that confidence to the child that what you did in your session is actually making you independent? And we had a hearty laugh, and she was a wonderful sporting mother. And she said, yeah, I know I'm making a mistake, right? I need to spend that 5 minutes extra to encourage the child to do things. And that's what it is, I think.
The example that you gave right is totally relatable. I mean, with everything that we do, and towards the end, it just, I mean, when it's not being done, just immediately after the session. So
Yeah.
it's totally relatable with what you say.
So I think I want to give one little small, simple takeaway message for the parent listeners here. And as an OT, I would say the best thing that you can do with a child who's struggling with motor skills or has dyspraxia, forget the diagnosis, even if he's struggling to learn simple motor skills, have fun with the child. Drop the batteries, drop your body. And what do I mean by that? Stop using battery operated toys because they don't give the child a chance to think creatively and use that toy in different ways. For example, if there is a battery operated toy against an old TV carton, the child can use the TV carton in so many ways. He could use it as a trolley, he could use it as a house, he could use it as a doll house, he could use it as an hiding place. So literally, drop batteries, drop your body. So when you're playing with a child, go down at the child's level and have fun with the child. Show to the child through your body language that you have all the time on earth at that point of time. It may be 5 minutes, but just tell the child that you have all the time and your attention is totally towards him and totally you're engaged with the child and interacting and enjoying the child. And stop thinking that fun is frivolous, because fun is not frivolous. So if you're having fun with your child, don't think that you're not being a great parent and you're not really parenting the child. In fact, that's the time you're parenting the child the best. So yeah, that was my little take home message for parents.
Thank you so much, ma'am. Thank you. It was a great time talking with you, with all the piece of advice that you've given us, and also for the viewers here, the parents. I think it was a very insightful session. Thank you so much,
Thank
ma'am.
you.
So, ma'am, with this, we'll come to the end of our question and answer round. So, on behalf of PlayStreet team, I would like to thank you, Anjali ma'am, for taking time to share your insight and your expertise for today. Your perspective definitely has added value, depth to our understanding of impact of dyspraxia in sensory processing. To our viewers, we hope you found this interview very insightful. If you have any questions or would like to share your thoughts, please feel free to connect with us. At PlayStreet, we offer a special program called the Dyspraxic Program, which encompasses intensive OT, ST, PT, upbeat, and co-regulation. If you feel that your child has dyspraxia, please also contact us for further details regarding the program. Thank you again for being a part of this conversation. Ma'am, thank you so much. It was a pleasure having you here. Have a good day.
Thank you. It was my pleasure.